Hi, all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Tria Deibert, who is the SVP of Culture and Team Member Wellbeing at Hackensack Meridian Health. Thanks so much for being here.
Happy to be here.
We had an incredible conversation about all the ways that HMH cares for their employees, that you're taking care of everybody, hearing their feedback, and then following through with it. So you've done that through things like Best Places to Work and then also the StandOut program, which was something interesting because you said that you felt that Best Places was a great gauge of where things were and it gives you a lot of really amazing information, but you were looking for a way to check in more often. So what was it that made you think, we're getting this really great information, we have great engagement, we're on the right track, but still wanting to do more, knowing that good wasn't good enough?
Yeah, absolutely. So, yeah, great place to work. We still continue to work with them and do that survey annually, and great organizational survey. But it was our leaders that made me make that leap. So, we really do listen to our leaders. And through the Great Place to Work survey, we noticed three measures that really drove engagement that were in the span of control of our leaders. And so it was three things around attention. One was huddling with their team, which was a custom statement for us. Another one was about involving the team, and the other one was about recognizing the team. So there are statements that relate to all of those. We packaged that as the standard work that works. And that's something that we've used with our leaders because leaders, like anybody else, very, very busy, lots of things you can focus on. And so it became almost like an open book exam to say, hey, we have data that shows when you do these three things consistently, your team's more engaged. So we were able to focus our leaders on here are the actions that drive engagement. And once we did that, we started to see the strategy take off. And I think I mentioned to you, my number one strategy is building the leadership capacity of our committed coaches so they can build strong teams. So when our leaders were talking to us, they said, this is great, but we'd love more frequent ways to get the pulse of our team as well. So we added StandOut through ADP, and that provides a strengths-based platform that includes a weekly check-in where the team member is empowered to check in with the leader. It's not the leader reaching out, it's the team member who checks in with the leader. And then a team-based quarterly engagement pulse. So, much like anything, it's never about just one approach or one tool. You really have to look at the full complement of different tools that will help your leaders be successful.
Yeah, I like that, Tria. It's interesting to learn about your approach and what you were trying to achieve, and then the systems approach you took to it in terms of being very focused on the questions and then packaging it up for your leaders, and then recognizing that a tool could be helpful. What I'd love to learn about, I think our listeners probably would love to learn more about, is what is that weekly check-in actually look like, especially if it's being initiated by the team member.
Yeah. So it has two questions that kind of help leaders see visually how their team member is tracking. So one is about bringing value. I brought value this week, and the other one is about the opportunity to use your strengths. So we always tell leaders, like, that's a great gauge week after week when you see that graph. If you see a dip, something is going on. But then it also asks you about what you loved that week, what you loathed that week. Two very strong words on purpose, right? To understand what are the things that really bring you joy at work that you love to do more of, and what are some of the things that deplete your energy at work. And then you have the opportunity to put in your priorities for the week, and also what you need from your leader. And so it's very near term, like you check in, let's say on a Friday morning. For me, I do it every Friday morning. It gives me an opportunity to reflect on the week and look forward at the next week. But what we've learned with this, and this is really key, is that in healthcare, we have basically like a little microcosm of the world, right? We have business folks, we have people at the bedside. Some people are at their computer and want to fill out the entire check-in. And then for some of our nurses, their priorities maybe don't change every week, right? Their priority is the patient. And so what we've encouraged team members to do is take 5 minutes at the end of your week and think about one thing you did really well and share it with your leader. And it's a simple practice, but it nurtures your own well-being, because if you're like most people, you spend all week thinking about the 50 things you could have done better instead of the one thing you're really proud of. And then for the leader, it's like you're telling your leader exactly what you'd like to be recognized for. And some of our nurse managers have said, with 30 nurses, I don't see every patient and family interaction. So I don't know about every great thing that happens. So it's like a gift to see it in my check ins and to know that one of my nurses is very proud of how she helped a family member that week, or how she helped a fellow team member.
It's interesting too how you do that. If you can save those things or you at least make note of them whenever you're doing things like great places. I've filled out those surveys for organizations before, and so many times there's only like, what are these three specific examples of this, and you have all of that data. So it's really complimentary to do ADP StandOut along with a program like that. It's not, okay, are we choosing this or that? It's how can we work together, and that again shows the commitment of HMH to the employees. So when you were talking about that weekly survey, I love that it's what you love and what you loathe, but the key that you mentioned to us before is trust with your people. Because if you don't have trust, you're going to get a lot of really fluffy stuff that they're going to say to appease you and keep their job, but they're going to be really afraid to say loathe. So, did you see that evolve over time? You said that you implemented this on Valentine's Day to show the commitment to love, that
Yes.
it was a gift to your employees. So did you see though from February 14th of 2023 to now that people are now more comfortable saying loathe, things that they loathe? And have there been themes within different groups that you've thought like, oh my gosh, this team really does love doing this more than we thought, and oh my gosh, we didn't do this, maybe this is something we can take off of them in some way?
Yeah, so what we say here at HMH is what happens in your check-in stays in your check-in. I don't see what's in people's check-ins. I don't mind that data. It's really between the team member and the team leader. But we do know that people become more comfortable sharing that in a couple of ways. So one is our CEO models it. So he frequently talks about the fact that he has his team check in with him, and that he welcomes the loads because he knows it's an opportunity. So that's a great way to kind of model the way at the very top of the organization. But the other thing is, I am not in all the different roles in the organization, so I don't know how it works best for other people. What we do is we hear what works really well for a nurse manager or the head of, patient accounting, whoever it might be, and we share their best practices with other leaders. And so through that, a lot of leaders have shared that they didn't realize there were certain small things that are depleting, that they were able to fix and address. One leader once told me that her top performer, like her best team member, put in her loathes something that is core to her job. And she took a step back and thought, oh my gosh, how do I address this? And she said, I had a conversation with her and we figured out a different way for her to do that. And now it's not a loathe. And to me, that was a really, really powerful example, because you're going to have to do things in your job sometimes that maybe do deplete you. But if you can have a really good conversation with your leader about a different way to do it, or somebody else on the team to do it, right? If you're really strong on our team, numbers are not my strong suit. I love the story they tell, but I'm not, I don't love calculating. My director is excellent at it, but she doesn't like to write. So we help each other out, right? It's like it gives you this really great opportunity to identify things that strengthen you, that strengthen your team members at work, and help each other do more of that.
I love that. That's kind of why it's a strengths-based program. It's
Yes.
amazing how that actually all comes together. So I really love that. I think, Tria, you probably already answered the question that I'm about to ask, but I guess I'm just already down that pathway. So I'm going to ask it anyway, because I think I'd like to hear you maybe give a few more examples. Oftentimes when we do surveys, especially in healthcare, the reluctance is partly because of what Stephanie's saying, the lack of trust, lack of vulnerability, lack of openness. So I'm not really going to say what I really want to say, because I don't know what they're going to do with this information, and maybe it'll come back to hurt me. And then there's the opposite side of, well, I've been answering these surveys forever and nobody ever does anything with it, right? So you kind of got at that already with your answer that, a team member, the leader acted on the load. But I'd love to hear more about it. What is it that's you're doing with your leaders to make sure that they know what to do when they get these check-ins back? And how do you ensure that they're actually doing something about what they're hearing about?
Two things. Acknowledging it's a journey, right? Trust takes time. Doesn't happen overnight. So yes, you may have team members who are reticent to share something in a check-in or in a survey at first, but once you build that trust, you'll hear from them. And I said there were two things. The second thing is closing the loop. So I have heard from team members sometimes, well, I put something in my check-in and I didn't hear back, so why am I going to check in again? Well, for me, that's an opportunity to have a coaching conversation with the leader and say, hey, here's a really great opportunity for you. If you get something in the check-in and you can address it, address it. Address it immediately. Let the team member know you're on it. And a lot of times it's a little thing. If it's something big that you can't address, it's not in your power, your span of control, acknowledge that too, right? Say, you know, like use a red, yellow, green, like a stoplight report. Like, okay, here we go. This is something that's in the green. I can fix this right now. Something that's yellow, I might need to take some time. So let me tell the team member, yes, we can get to this, but maybe not this year. And then something that's in the red. That's a huge capital investment. And it's going to take a lot of time and a lot of strategy to get there. That might not be something that we can do, right? If you're honest about that, it goes back to trust, right? If you're able to say, there are some things I can help you with right away, some things that maybe will take some time, and some things that are bigger than what we're talking about here, and you're honest about it, I think that builds trust.
That's awesome. That's awesome. And I know you said you're not mining the data because of confidentiality and you want to keep it private, but at the same time, thinking like a performance improvement person and also leveraging this amazing system you have. Is there any anonymized data that you track to trend and say, well, so many people had the same issue to report, and so this has to kind of go to the top of our list for capital improvements or anything like that? Is any information like that flow out of the check-ins?
Not yet. When I feel very confident that it's anonymized and that we're looking at it, AI is a game changer, right? I'm able to take feedback from lots of different places, put it into AI and say, and we have our own internal chat so that it's not public, right? Because we have sensitive information. But when I'm able to put something in and say, I even did it this year with our whole team's accomplishments, right? I had 20 pages of accomplishments, and with the right prompts, you're able to get something really succinct. So I do envision at some point that we would be looking at that, but we're very protective of that relationship between the team member and the team leader.
It's obvious when you're talking how important the experience is for everybody, and that it does feel like a very safe and loving environment. And so that was one thing that you said before. You said, I love a data-driven strategy. It's important, but it has to be done with love and packaged with love. So tell us, why does it have to be like that? And, you feel very comfortable using love too, which is something that Apoorv and I both feel strongly about. Because, and Apoorv, I've told the story that he said when he and I were talking about what words to use, we were going back and forth. We use empathy, it might be more accepted to hear that than love. And then he said, well, what happens when, if they don't have anything to feel badly about? What if we have nothing to empathize, but we can love them all the time? And so I think that's a perfect example of what you guys are doing. So how do you really build that and help foster that? And why is it so important?
Yeah, I think so. My team, we have our own team purpose, right? That we develop together, and it's to build a workplace environment that makes people fall in love, stay in love, and share their love for HMH with everyone they know. So that's my team. That's what we're focused on. I think it's important because of, especially here in healthcare, I wasn't in healthcare my whole career, but everything that we do in healthcare is about love, right? There, the whole idea of making someone healthy again or holding their hand, every part of that is with love. So for me to go out with a strategy that wasn't grounded in love, I feel like it would be disingenuous in healthcare, and I don't think it would resonate with our team. Um, it's key to what we're doing. So the way we do that, right? We have this strategy that we're focused on. How do we package it in a loving way, and how do we activate around it in a loving way? And StandOut was an example of that, right? We when we introduced it, we focused on, helping team members discover their top two roles. And we had a giant heart with all the standout roles on it, and people were pointing at their two roles, and it was Valentine's Day. And we talked about the fact that the tool's really going to help you do more of what you love, because when your leader understands what you love, they can help you do more of that. But also that when your leader is able to take the best care of you, you're able to take the best care of our patients. And in healthcare, I think everyone's really purpose driven, no matter what your role is. That's why you're in healthcare, right? I didn't come into it that way. Frankly, it was a great opportunity. And I came into a marketing role and thought, okay, great, I'll be in consumer marketing now. And then I was like, whoa, this is a totally different thing. And I love it. I fell in love with it. And so I think that's what happens to a lot of people when they come into healthcare. And in my role, I don't create the engagement. I don't, create strong teams. Leaders do that, but I can bring the love. So that's something that that we focus on every day.
What a journey, Tria, you have described of yourself and the organization and this. Wow, fantastic. I'm so excited that our listeners are going to get to hear this. It's amazing. I guess being a performance improvement person and like you being a data person, my final question, if I have to add anything else onto that eloquent statement you just made, is how are you sensing that this is making a difference? How is this helping the organization? Is it in the survey numbers? I think you were mentioned something about the Great Places to Work survey and how that may have improved. But is it also showing up in any other metrics at all? What's the larger impact that this program is and the whole approach is making?
Yes, I'm so glad you asked that, because we've talked about a lot of the wonderful, soft, and lovely things about engagement. But I always say that our investment in our team leaders, right? When we invest in our committed coaches and when we invest in consistent and meaningful attention, it pays the best dividends. And we've seen that. So we saw a statistically significant increase in engagement the first year we implemented StandOut. Subsequently, we've also, through our survey with Great Place to Work, we've been recognized as a best place to work in healthcare, a best workplace for women. And this year, I'm so proud to share that we'll be on the Fortune 100 best workplace list. So those have been some accolades. More important, as we've strengthened our teams, we've also seen in the last 2 years a 25% reduction in turnover. And we're below 10% for turnover. We've seen improvements in quality and safety and outcomes. And we actually, when we were just looking at our data this week, and what we're seeing is, and I'm so sorry I don't have the numbers handy, but I think we hired like 8,000 people last year. Our turnover went down, right? So think about that. It's not a leaky bucket, right? In healthcare, there was a couple of years where it was really, really hard to attract team members. We're attracting more team members. We're seeing less turnover. Our engagement's up. Our most important metrics around quality, safety, and patient experience are up. So sometimes people think about engagement and culture as, oh, you do the soft stuff and you throw parties and no, no, no. It is the thing that when you get it right and when you strengthen your teams, you see all those great outcomes. So I'm glad you asked that.
Phenomenal. I love that. I'm just clapping away over here. So thrilled to hear that you are able to tell that part of the story. Thank you for sharing that.
It is. I think that's part of the thing that people really have a hard time making that leap, that when you do focus on these soft skills that people think, sometimes candidly, I think they think they're blow off skills.
Mhm.
It really does filter through. You can't have a successful organization, in my opinion, without getting that right. And so you are clearly getting that right. Thank you so much for sharing how to do that with everybody who's going to be watching this. And hopefully more people follow your lead. We really appreciate your time in this conversation.
Thank you. And it's our leaders that are getting it right.
And thank you all for watching. We'll talk to you soon. Bye bye.